Hello, this is Chris from the Obstacle Doc, and today we're going to look at a pretty cool exercise gadget. This is the TheraBand FlexBar. There are some pretty inexpensive knockoff versions of this. To be honest with you, is just literally a rubber bar. So they do come in different densities, which will kind of equate to different amounts of resistance. I like this circuit a lot for we'll say our tennis elbow, our golfer's elbows, but our tendinopathy cases in our wrist and forearm that tend to happen with overuse can definitely become a really recalcitrant type of injury that people in the gym, our climbers, our lifters, our ninja athletes really kind of suffer with. It is not a fast fix, especially when they are clinically diagnosed. These can take multiple months to really resolve. But the undertone of actually how you treat tendinopathies at the common extensor and flexor tendons is you actually have to develop loading adaptation. So you actually have to use it to get it better, which sometimes sounds backwards because we don't want to use what doesn't feel good, but actually that's how you end up getting over the hump. Before we get into the exercises with the flex bar, we're going to look at the 6 cardinal plane movements that we are going to target in the wrist and forearm. The first one that we're going to do is active wrist extension. So again, everything bends just straight from the wrist as they come up. To complement wrist extension, we're going to flip our hands over and we're going to work on wrist flexion. Our deviations are the following. Our ulnar deviations, we're going to think about the outside, our little finger, and we're going to twist our wrist outward for ulnar deviation. Whereas with radial deviation, we're going to reference our inside, our thumbs in our inner forearms, and we're going to twist inward. Finally, we're going to look at forearm supination and pronation. For supination, we are rotating the wrists so that the palms finish in an up position. Rotating back for pronation, where the wrists face downward. So palms up, supination, palms down, pronation. So the flex bar is a creative gadget that you can use that targets a majority of the movements that come out of the elbow, wrist, and forearm. And you can do this as a circuit. I highly recommend having this in your gym bag. You can take it with you. It can be used as a pre-workout to your bigger lifts. It can be done pre-training for your ninja athletes, for your rock climbers. It kind of gets things ready for the loads you're about to do. So we have 6 motions that we're going to look at the wrist and forearm. We're going to do these in 2 different elbow positions because it does affect the way the pull is when our elbows are straight versus when our arms are bent. So our first motion is going to be stabilizing with the left hand. Daniela is going to throttle or rotate forward with the right. And she's going to repeat that twisting for about 30 to 60 seconds. Now you can change rate. You can go faster, you can go slower. Now the beauty of it is the other arm is actually working. So while she's moving this arm is stabilizing. So you get a nice 2 for 1. So that works on resisted wrist flexion, as you can see here. If we want to work on resisted wrist extension, she's going to slide her hand forward and twist backwards. And now we have resistance coming to the top of the wrist and forearm. So that gets 2 of our 6 movements. Now our next movement, we're going to take the bar and we're going to hold it out straight. Top hand's going to be like a bottle cap. We're going to open the bottle. So we're going to twist outward and then come back, twist outward and come back. Again, the hand that's stabilizing is actually working at the same time. So we are getting what we call ulnar deviation as she twists outward. And then if we switch it and we start with resistance coming inward, we are now getting radial deviation. So again, think of this as the bottle cap twist for 2 additional movements of our 6. And now our last series to complete the loop is we're going to work on forearm pronation and supination. So with the elbows tucked at our sides, we're going to bend the bar evenly at both points of view to bend to create our U. And we are working on wrist supination. And now to go the other way, hands are going to be in an underhand grip. And we're going to bend the bar together. Again, making sure the elbows stay at her side so they don't flare out. We don't want this to be a shoulder exercise. We want to focus our efforts at the forearms for pronation. So this series of 6 movements can be done elbows bent, and they can also be repeated elbows straight. So you would go through one whole series underneath, one whole series outstretched. Again, recommend about 30 to 60 seconds for each series of movements. You can go through this at least 1 to 2 times. And again, it can serve as a warm-up to your bigger lifts and exercises or activities. It can also be done as a homework assignment at least once a day. This can be coupled with other conventional exercises that we can use with dumbbells to also strengthen the forearms. But again, for portability's sake, for versatility, it's a nice gadget to understand. And it's a great exercise that my clients like to use when they're trying to, again, warm up, build up some durability in the wrist and forearm as they're dealing with some of these overuse injuries that can occur with the sports that they're doing. A secondary exercise that you can do that kind of complements the both arm pronation moment, if you want to focus on one at a time, we're going to demonstrate using the left as the active. The right is going to be the stabilizer. So against a table or a basic surface, Daniela is going to bend, flipping the bar over top of the opposite hand. The goal is to get the palm of the moving hand to mirror the back of the hand of the opposite, and that is creating our pronation moment. You do want to watch that the elbow doesn't flare out as she goes so that we keep it in the forearm. Instead, if it was to flare out, it becomes a little bit more of a shoulder movement. So we want to keep this nice and tucked and really focus our efforts at the forearm. To isolate forearm supination, we cross the arms. So our anchor hand is going to be Daniela's left. Our moving exercise arm and hand is going to be the right. And we are going to flip to get the back of the hands to match, thus creating our forearm supination moment. Again, these can be useful because it's isolating one arm at a time as compared to when you bend the bar where both arms are bending at the same time. So if you really want to try to target one over the other, this is a nice breakout instead. When we work with the bar, the stabilizing hand can be whatever's comfortable. If the thumb wants to be over top, that's okay. But with the moving hand for any of the movements, you want a conventional grip where your thumb is coming underneath the bar for all motions.